Good day everyone! My name is Carizal Jenna Asada, student nurse from Our Lady of Fatima University. So today I will perform bed bathing, shampooing, oral care, and back massage to the patient. So before we proceed, these are the following procedure that we need to do. First is gather all the equipment. Make sure that you gather all the equipment that you need so that you won't consume any much time. And second is perform hand hygiene to prevent the spread of infection or any bacteria. And the third one is identify the patient. Make sure that you have the right patient before you do the procedure. And the fourth one is provide privacy so that the patient will be comfortable and trust the nurse. And the last and fifth one is explain the procedure so that the patient is aware of what procedure you're gonna do. The first I will gonna do is bed bathing and shampooing the patient. So here's are the following materials or equipment that I'm gonna use. For the bed bathing is soap and warm water, 2 towels, one is for dry and one is for the wet. This one is I will gonna use it po sa pang bed bath. Ito po yung babasain ko na pangpupunas ko po sa katawan ni patient. And ito po yung gagawin ko pong pang dry or pang punas sa mabasang part ng katawan ni patient. And also pang drape po sa katawan ni patient. And also alcohol. Sa shampooing naman po, kailangan po natin ng clean gloves if necessary, clean comb and shampoo, 1 towel. Ito po yung gagamitin natin pantakip sa mata ni patient para po maiwasan na malagyan ng tubig or ma-irritate ang kanyang mga mata. 1 towel po pang support o ilalagay po natin sa ilalim ng ulo ni patient para po hindi po mabasa ang kanyang suot. And another towel po, ito po ay gagamitin sa pag-dry ng buhok ni patient after po niyang ma-shampoo. And next is dry cotton balls. Ito po yung lalagay natin sa both ears ni patient para po hindi malagyan ng tubig ang kanyang mga tenga. And also, tabo po or dipper, ito po yung gagamitin natin pagbuhos ng tubig kapag i-rinse na po natin yung shampoo. So, nagawa na po natin ang unang procedure, which is gather all the equipment. Next po is I will perform hand hygiene, or pwede rin po na maghugas na lang kayo ng kamay if necessary. So, para po mabilis na lang po matapos, mag-alcohol na lang po ako. Or kung kayo po ay nagmamadali at wala na pong time mag-hand washing. And then, I will identify my patient. Hello ma'am, good morning po. Ano pong pangalan ninyo?
Catherine po.
Ilang taon na po kayo?
17 years old.
And kailan po yung birthday nyo?
January 19 po.
And then, check for a wristband. And after identifying the patient, and you provide privacy. So, after you provide privacy, explain the procedure to the patient. So, ma'am, ang gagawin ko po ngayon sa inyo is bed bathing po kayo. Ang ibig pong sabihin is, papaliguan ko po kayo using just a towel. Papaliguan ko po yung buong katawan. Okay lang po ba?
Yes.
And isa-shampoo ko po yung buhok nyo na kahit po nakahiga kayo. Okay lang po ba? Okay. Now that nagawa na natin yung 5 procedures, proceed na po tayo sa bed bathing. Loosen the top sheet and replace it with a bath blanket. And then remove the client's clothing under the bed blanket. Raise the patient's head gently and spread or put the bath towel under the patient's head. And then wet the washcloth and fold it around the hand in a mitten fashion. Using circular or strokes movement, wash the face using bath towel. And then pat and dry the patient's face. Remove the bath towel, place it on the patient's arm nearest from you. Wash with soap and water using firm strokes from distal to proximal. Then pat it dry. Immerse the patient's hand in water for 3 to 5 minutes. Soap and wash hands with washcloth, paying attention to the inner genital spaces. Then pat it dry. Repeat the procedure on the other arm. Now, across the chest and abdomen, soap, rinse, and dry, paying attention to the area of the umbilicals and under the breasts. Pat dry, then cover it. Next, expose the leg by folding the blanket towards the midline, then drape the other leg and genital area with bath blanket. Wash the leg using long firm strokes, paying attention to the private area, then rinse and pat dry. After that, immerse the patient's foot for 3 to 5 minutes and then wash it with a wet washcloth. Then pat it dry. Don't forget to assist the client in dressing. Repeat the procedure on the other leg. Dispose the materials that you use, then perform hand hygiene, then document the procedure that you did. Next is shampooing. Make sure that you prepare the warm water for the shampooing and all the materials that you need. First, position your patient in a comfortable position. Then place a bath towel under the patient's head. Then check the water temperature. Then after that, perform hand hygiene and put on gloves. After that, inspect the patient's scalp. Look for any wound or if there is any dandruff or flakes, or to identify any abnormalities of the scalp. And after you inspect the patient's scalp, comb the patient's hair before proceeding to the shampooing. Place a one towel on the patient's eye to avoid irritation. Then put 2 cotton balls on the patient's ears. Now, pour the water on the patient's hair. Make sure that the hair is fully wet before you put the shampoo. Then, after you put the shampoo, spread the shampoo to the patient's hair and massage the scalp. After that, rinse the shampoo until fully gone. Then after that, dry the patient's hair using another bath towel. After drying it, comb the patient's hair again. Now remove the towel and the cotton balls and the bath towel on the patient. Then dispose all the materials that you used. After that, remove gloves, then perform hand hygiene.
So now that we're done doing the bed bathing and shampooing the patient, now we proceed to the oral care for the patient. As you can see po, pinosisyon ko na po yung pasyente ko in a sitting position. So, bago po tayo mag-umpisa, ito po yung materials na kailangan natin para sa oral care. Gloves, toothpaste, toothbrush, alcohol, mouthwash, container, pang-drip po sa patient, and lastly is mineral water po, pang-gargle po ng patient. So, bago po ako mag-umpisa is magpe-perform po muna ako ng hand hygiene.
Tell and assist the patient to gargle for 30 seconds. After that, get the toothbrush and the toothpaste and put toothpaste on the toothbrush. Tell the patient to open their mouth, then start brushing from lower teeth to the upper teeth. Then proceed to the front teeth and do the circular motion of brushing. Brush the patient's each side of the teeth. After that, ask the patient to gargle again for 30 seconds. After that, offer the patients a mouthwash by mixing a water and a mouthwash. Then, ask the patient to gargle for 15 to 30 seconds. Then wipe the patient's mouth again. After that, remove gloves and perform hand hygiene. And then document the procedure that you did.
We're gonna do the last procedure, which is back massage. So before we proceed, these are the following materials that we're gonna need. First is efficacent oil or oil to use para po sa pag-massage sa likod ni patient. Alcohol para po sa hand hygiene before po mag-massage. And polvo po o baby powder na if gusto ni patient na lagyan ng polvo yung likod niya after massage. And last is yung tongue drape po. So papalitan na po natin yung ginamit natin sa bed batting na sheet para po tuloy-tuloy na po si patient sa pag-rest.
Before you start, perform hand hygiene. And then, put the top sheet back and remove the bed blanket. After that, position the patient from supine to prone position. Make sure that your patient is comfortable before you start the procedure or before you start the back massage. Itaas po ang damit ni patient and magpaalam po na i-unhook niyo po ang kanyang bra. So dahil mataas po ang bed and kailangan ko pong umakyat para po ma-perform ko po ng maayos ang back massaging. Maglagay ng oil sa kamay and then spread sa likod ni patient. The first step is effleurage. Next is friction movement. Next step is tapultment. And the last one is kneading. Then, if nag-ask po ang patient na palagyan po ng powder ang kanyang likod para po hindi malagkit sa filling yung oil na ginamit natin. And then, papag-side po natin ang ating pasyente and mag-rest po siya ng 15 to 30 minutes. Then, perform hand hygiene.